recent news, Salman Khan talked about his health situation, that is a brain aneurysm and a trigeminal neuralgia. I'm Dr. Manvir Bhatia, a senior neurologist, and I will be talking about these two conditions which sometimes we are not really very well aware of. So what is a brain aneurysm? A brain aneurysm is a ballooning of the blood vessels of the brain, and imagine it's like a weak spot in the arteries. So sometimes it can be very tiny for a few millimeters to a few centimeters, and it can occur in almost any area of the brain. It can sit silently, meaning not produce any symptoms, but it can produce symptoms if it starts irritating another nerve, as it did in his case, or it starts creating symptoms by causing pressure. It can cause pressure, or it can also rupture, and that's like a sudden burst of blood into the brain. So the symptoms can be headaches, it can be continuous headaches or a sudden severe headache, double vision or impaired vision, stiffness of the neck, and of course, if it ruptures, people can become unconscious and lose consciousness altogether. How to diagnose this condition? We have imaging techniques or modalities, a CT scan of the brain, an MRI, or if you want to go further, if there's a suspicion, you can also do an angio of the brain to determine the size and the position. This helps you to decide how to take this further and how to treat it in the best way. Now, what about this trigeminal neuralgia? The trigeminal nerve is a fifth nerve coming from the brain. It supplies one side of the face. So we have two nerves which come on either side. Neuralgia means a pain. So this condition is severe pain which comes like an electric shock-like sensation. So they are very short in duration, but they come on one side of the face. They can come around the eye, the cheek, or the lower jaw, and multiple times in a day. It's also interesting that there could be some triggers, like people speaking can get it, eating can get it, washing the face, shaving, etc. So this is what we need to know when people talk about a pain on the face. Again, the diagnosis is mostly by clinical, that is by talking to the patient, but we need to confirm or check what is causing the neuralgia, and then you can do a brain imaging to see if something is irritating that nerve. The treatment, we have lots of measures where we can decrease this irritation of the nerve by medications. And of course, as a last resort, there are some other interventions like surgery. So just to say that awareness of these conditions is important. Just do not neglect these conditions and say, oh, it is simply because of stress or just it will pass. So any of these symptoms which are persistent, disturbing, occurring on a continuous way, you experienced or your loved one, do seek help. And when celebrities come forward with these complaints, it does help to create awareness about this condition. So I do hope that stay informed, take care of your health, and this has been informative for you.